That was Mike Graham sacking in a small town. Good morning, Montgomery County. It is March 27th, 2014, another gloomy day in Montgomery County, and especially in downtown Conroe. I don't know what the deal is with this weather. It's supposed to rain today. I will give you a little bit of a weather update later because right now I got a special guest in the studio, and it's an interesting guy. I've been chatting with him for a little bit, and I'm looking forward to getting to know him. I have Dr. Aves in the studio right now. Doctor? Welcome.
Good morning.
Can I call you doctor? Is that how you like to be?
Richard, you can call me anything you want.
Okay.
I'm fine with it.
All right. Well, Dr. Aves is in the studio, and if the worst thing about interviewing doctors is what their subjects is, they usually have words that have more than 5 syllables. So you can imagine that's really hard on the radio to pronounce. So tell me exactly what you do in the full science term.
Well, honestly, I like to use the acronym KISS, keep it simple, stupid, so I don't have those 5 syllable words. But just to give you an idea of what I do, I'm a physician here in Houston, trained as an anesthesiologist and now in pain practice. And because of my background, my history, and actually my own medical problem, I've developed a very unique specialty in dealing with migraine therapy.
Okay, so you're talking about headaches. When you say migraine, I just want to make sure.
Well, let me give you a definition that distinguishes headaches from migraines.
Okay.
Headaches are pain in your head that you have that you can treat with medications you can get over the counter and still allows you to function during the day. But migraines is a pain in your head that despite what you take, nothing relieves it, and you end up being in a dark room with the door shut, lights off, pillow over your head, and you're totally non-functional.
So if I remember correctly, I know I'm not, like I said, I'm not a doctor, but when you have a headache, that's something where vessels in your brain expand and it's literally pressure being pushed against your skull. Is that what it?
And I
don't know.
Richard, I'm very, very happy that you actually brought that up because to me that's the most common misconception. Most people think that the headaches are inside their skull, in their brain. And as you said, the theory is that blood flow in the brain, blood vessels swell, they cause what we call edema or swelling of the brain, and that leads to the headache. And the majority of medications that are out there deal with affecting blood flow in the brain either by decreasing the size of the blood vessels or decreasing blood flow from the heart to the brain. And my practice is totally different. I've had migraines for about 30 years, and I've been through all the pitfalls. You get placed on medications that may or may not work. It takes 3 months to get a significant level of the medications, and if it doesn't work in 3 months, then they go through a smorgasbord of medications and alternate it. And before you know it, you're a year or 2 years into it, and you still have no relief. And a lot of the medications, the definition of being successful is decreasing your migraines by maybe 30%.
Which is pretty big.
Well, it is pretty big because every day is very important.
Yeah.
But if you have, say, 15 migraines a month and you're looking at 30%, you're still looking at 10 days a month where you're still miserable.
Yes. And you can't be productive, and that's awful. And especially with the people around you who depend on you or you care about. That's that's pretty bad.
No, you're absolutely right, Richard. It's a downward spiral, especially since not only does your job suffer, because a lot of these patients can't predict when they're going to have a migraine, but your relationships suffer, your family suffers, you can't spend time with your children. It's a very difficult problem to deal with. So what I've looked at are actually more treatable causes of a migraine. A lot of the medications deal with headaches or migraines that encompass the entire head, more so like a black box where you just give a medicine, hopefully this will help. But my therapy focuses on specific areas, either in your neck, the side of your head, or the front of your head, where we have nerves that innervate that area. And what I've found that by treating these specific nerves outside your brain, outside your skull, it allows me to find the trigger of the migraine, and that allows me to then focus therapy towards that area.
Because one of the most amazing things about the human body is we still don't completely understand how it works, and we're continuing to find new ways. Because I bet 150 years ago, if someone said, "Oh, I can figure out what's going on up here by going down here," no one would ever even think that was possible, going below the head, because they think it's happening in the head. So your practice, I mean, are you still learning a lot more about how the brain works?
Yes, I am. And amazingly, in medicine, there's a lot of things we know, but I can tell you there's a lot more things we don't know. And despite the fact that we don't know it, we still apply medications or therapies to that area without knowing the specific mechanism of action. And if it works, it works. If it doesn't, you try other things. But my therapy, let me give you an example, Richard.
Okay.
You have a patient who tends to have a migraine, a bad headache that starts in the back of their head and moves forward. Very typical.
Okay.
A lot of those patients in the past have had some kind of trauma to their neck. Cervical trauma from car accidents. You're football players. They lead stressful jobs and they wear their tension in the back of their neck and their shoulders. Well, a lot of those problems can be dealt with by dealing with the nerves in the back of the head, because what happens is the muscles in the back of the neck get very, very tight. And when those muscles get very tight, it constricts the nerve that runs up the back of the head, and it causes a decreased blood flow and oxygen supply to that nerve, and it leads to pain in the distribution of that nerve, and then generates the headache. And if you recall what I said earlier, majority of medications treat what's inside the brain. If you're not treating the primary area, the trigger of that migraine, you're still going to hurt.
Yeah. It's going to come back.
It's going to come back. And amazingly and fortunately, the evaluation of these migraines can occur. If you come in with a migraine, I can evaluate it and do specific injections and give you relief on that very visit. You don't have to wait 3 months, and we're not guessing on what we should do. So it's very rewarding.
I imagine, especially for those who only have 10 days out of the month, or only have 10 days where they can't function. So
yeah, it's amazing, because what you find is that these patients become a slave to their migraine. Their migraine tells them what day they can do things, what they can do, and whether they can even leave their house. But if you give patients an ability to identify what's causing the migraine and have active tools to deal with it, it does a complete 180, and they can manage their lives more efficiently.
Okay, well, we're going to take a quick break, Dr. Aves. If we don't mind, if we come back, we're going to learn more about you.
I appreciate it.
Because you said you have your personal experience with this, and I'm interested to see what that was, and especially your rich history with your education of medicine, because you've been around for a while, and I want to know more about that. We're going to play a couple of tunes before we get back with Dr. Aves and more about pain management, especially with migraines. So we'll be right back. We're going to be listening to hear some Pat Green with Eden's Gate. You're listening to Lone Star in the Mornings.
Hi, I'm Joyce with the Corner Pub in downtown Conroe. We're located at the corner of Simonton and North Main, just across the street from the courthouse. The week starts off Monday with open mic hosted by Alan, and Tuesday nights open mic hosted by Jeremy Bankhead. And on Thursday evening, McFarland Jams. There's nightly drink specials available every night, all night. And don't forget, live entertainment every weekend. To see a full list of events, visit our website at thecornerpubinconroe.com. So come join us at the Corner Pub, where the deli is open late.
Have you ever wandered around a parking lot trying to look like you actually know where you parked? Then you'll love the Mark and Cindy Show. If buying toilet paper with aloe vera is the most exciting thing you're going to do today, then you'll love the Mark and Cindy Show. Even if you haven't tweeted, you'll still love the Mark and Cindy Show.
How about twerking?
Ew, that was one step over the line, Mark.
Well, you said toilet paper.
Look, we want listeners to tune in to the Mark and Cindy Show at 10 o'clock every weekday morning here on Lone Star Internet Radio.
The Mark and Cindy Show, it's like visiting with your best friends for coffee, except we will never stiff you with a check.
And one of us always knows what she's talking about.
Well, okay, but it's still called the Mark and Cindy Show. You know that.
We'll see. The Mark and Cindy Show. Tune in to Lone Star Radio every weekday morning at 10 o'clock.
Which led to a lot of coughing, and the coughing led to severe muscle pain in my neck and upper back. So I had a severe migraine. I went to the emergency room. They stuck a needle in my back to check to make sure I didn't have meningitis. And of course, that caused another type of headache, which is a spinal fluid leak headache. Well, to make a long story short, they couldn't find what the headache was due to, so they classified it as migraines. And I was on medications for 3 months and basically went through all the pitfalls that I've described. And the main thing that bothered me through all this was that it made it very difficult to function with the medications on board. It decreased your cognitive ability, so it was like working through a fog or walking through a fog throughout the day and being there but not being quite all there. And I found that to be very frustrating. And
this is while this is going on, were you going to school and all that stuff for medical school?
This is after medical school.
Oh, wow, okay.
And in my residency training here in Houston at the University of Texas. And, I did fine. I was able to function fine, but you're not at your best. Athletes describe themselves as being maybe 80% or 70%. I would definitely say I was not 100%. And you really don't actually appreciate that until you actually are 100%. You can actually see the difference. And that's what I want to convey to your listeners out there. I'm sure you have a lot of listeners with migraines, and I can tell you if they do have migraines, they're nowhere near 100%. And if they can experience that just for one day or just a few days a month, it's a life changer.
When it comes to migraines, I've always wondered, because I've never really suffered a serious headache. So when can a person tell it becomes an issue? Is this just because it's a reoccurring deal, or if it is severe pain, that's something that doesn't seem normal? Because some people get headaches because they're dehydrated, or they've been staying up too late, and it's just the body reacting to what they're putting on themselves. But what would you tell our listeners, when to actually take action?
Well, the first thing you need to do is make sure it's not a life-threatening event. You want to make sure it's not a bleed in your head, and that's what we call a cerebral aneurysm. So that needs to be evaluated, and also to make sure there's nothing in your head that shouldn't be there, like a brain tumor or a mass. So we always do MRIs on patients with that. But it can be as simple as a college student who studies all day long, and all day he has his neck tilted at about 45 degrees looking down at the books. They'll develop a severe pain in their neck. The muscles get very tense, and next thing you know, they'll have a severe headache. And they'll go to a doctor, and because there's nothing that they can find, they'll call it cluster headaches or migraines. And the disappointing thing about that is that they get put on therapy like I had been, where it decreases your ability to think and to study. It really makes it difficult for them to get through school. So if you have recurrent headaches, migraines, anywhere from 5 to 15 a month, then that's something that definitely needs to be looked at. Rule out life-threatening problems like I just discussed, but try to find a means to treat your headaches other than taking 15 ibuprofens a day or aspirin or Excedrin headache relief, because you're tearing up your stomach and all the Tylenol is killing your liver, and that you're not finding a solution. You're just putting a Band-Aid on the problem.
No, so what's interesting to me too, and I have to ask you as a doctor, and especially with your personal experience, I imagine a lot of things that have to do with medicine, because every time I visit the doctor and I think about a doctor, it's really that they don't know the instant answer, but it's the process of finding out what it really is wrong and then finding the right way to make it better. So with your practice, do you like that process? Have you really come to agreement with it, where you like treating people and finding out what really is the right solution instead of putting a Band-Aid on it, like you said, and especially with other doctors where they just deal with the head instead of the rest of the body?
Oh, absolutely, Richard. Every medical problem has a differential diagnosis. And you work through that list of possible medical issues that can be causing your headache or migraine. And it's not just the life-threatening problems. It could be your blood pressure being too high or your blood sugar being too low. You need to look at everything when it's involved. But when it gets to the point where you've evaluated all the other issues and are left with true migraines, what I do at that point is then evaluate the patient, careful history, what they do, what they've done in the past, whether there have been any car accidents or anything that could be focal about their neck, or if their job is very stressful, it could lead to severe muscle spasms either on the side of their neck or in the front of their head, or even if they grind their teeth at night and they bite down and they wake up with severe headaches in the morning. What I tend to do is, once I determine what part of the actual head is hurting, I can do selective nerve injections to that area, and if they get relief from my injections, the relief can occur in a few minutes, then a light goes on and we've identified what the trigger is for that migraine. It's an amazing situation.
Now, when it comes to ages that you treat, can all ages be involved? Because I don't really remember getting headaches as a kid, but then again, I imagine there are children out there who do get a lot of headaches and migraines.
Well, that's a good point. In fact, I've seen several patients, young children, with they've been labeled as having migraines or cluster headaches, and they've been put on medications that you can tell dulls their senses. Their mom kind of likes it because it slows them down a bit, but overall the kids are walking around in a very mild stupor. And when you look at the child, you examine the child, you can tell that a lot of their headaches, their pain, isn't coming from inside their head. The medications we're using isn't focusing on the problem, it's focusing on the collateral issues of the problem. And a lot of these children, they have severe neck strain, severe spasms in their shoulders, either from the activity that they're doing, because kids are very, very active.
Yeah.
Whether they play soccer.
Especially with their body growing, and then they're putting their body through those day-to-day activities.
Yeah, and it's actually very stressful on them.
Yeah.
Football, going up through school, they develop a lot of shoulder pain, a lot of neck pain, and boom, there you go. It's a headache. And, immediately people feel like, well, they've hit their head too many times and it's a concussion and it's a brain injury. But 99% of the time, their MRIs of their brain are normal. And then that's when they get placed on medication, which if you take the time to listen to the child, to examine the child, and try other techniques, you might be able not only just treat the headache, but keep them from recurring and even coming back if you know where the focus is.
Because that's the main point, I would say, right? Is to fix the problem.
Oh, absolutely. And honestly, Richard, I'm not going to be grandiose and say that I can cure people. In fact, I can guarantee you 100% of the time I won't cure you, because these problems are chronic problems, just like hypertension is a chronic problem, diabetes or heart disease. You don't cure patients, but you can make them better. So if a patient has a migraine 15 times out of the month, more often than not, I can do better than just 30% relief. And I won't cure them, but I'll definitely have them go through more good days than bad, and to allow them to have more control of the situation and have them to be more functional in their career, in their relationships, and just their outlook on life. It's very
important. Yeah, it's very important.
And the reason why is when you have a migraine, and a lot of people who don't have migraines can't relate to this. When you have a migraine, a minute seems like hours, and an hour seems like days. And if you've had a migraine for days, you just want to put a bullet to your head. You just don't want to go on anymore because it's just not worth it. You can't eat, you can't sleep, can't get rest, and you definitely don't want to deal with anybody else. So it's a very, very sad situation for these people.
So if a listener right now has one of these migraines, what do they need to do to get into contact with you?
We have a phone number, if you don't mind me putting it on the
air.
air.
Yeah, go for it.
713-863-7246. And we have 4 locations throughout Houston, one in the Woodlands, Katy, another one in Memorial area off of I-10 and Bunker Hill, and then in Pasadena. And this allows me to go to the areas where the patients are to be able to take care of the patients so they don't have to drive all over town.
That's good. So the one in the Woodlands is do you know where it's located here? Or if can I go online? Do you have a website?
Yeah, we have a website, and the website's called livewithrelief.com.
Livewithrelief.com. Actually, I'm going to it right now. I like doing that right on the spot. Check it out.
Yeah, and
Okay.
the location, I could give you the address, but it'd be easier just to identify it. It's just north of the Rayford Sawdust exit on the southbound feeder, and it's a big sign that says Pain Relief Associates.
It's right before, if you're going south, right before the HEB. Just to let people know, it's right before the HEB, and then you could probably see it right after the HEB if you're going northbound.
Right,
So-
absolutely. And this is the other thing that I like to pride myself on the practice. You don't need to wait 3 weeks or 3 months to come to see me. If you have a problem, you can call my office, and more likely than not, I can get you in. If not that day or 2 days, definitely within the first week.
Well, especially if a minute seems like eternity to these people. That sounds, I don't know. I've never experienced that, and I don't want to experience that. Actually, that's a question I do have. Is there any way to prevent these kind of things? Or is it just something that the body reacts to and there's no control?
Well, typically migraines, and you'll see this for the family history, you'll see that a lot of these patients with migraines, either a mom or their dad have had it, and their grandmothers had it, or their aunts have had it. So there is a genetic component to migraines. Now, can you avoid it? And that, I can tell you this, if you can identify the trigger, and that's why I do what I do, if you can identify the trigger and you can find out what's causing the migraines, whether it be muscle strain, primary neck problems from a car accident, we can do selective injections to your neck. If it's because you're biting down at night and you've got severe headaches on the side of your head, if you've got an infectious problem like sinusitis, if you can identify what the trigger is and not just think of your migraines as being a black box inside your brain, but actually treat the specific cause, then you can do what you just said, is to prevent the trigger for the migraines.
Because I know a lot of people who do have migraines, they don't really know where it comes from. And so it's all of a sudden it's there. And it's like you said, they focus on it, they can't focus on anything else.
Right.
So
because the pain is so severe, it's difficult to identify where it's coming from because it generalizes to be all over your head, and you tend to not distinguish different components of the pain. But the amazing thing is if you can alleviate just certain portions of the pain, it helps the patient to not only to be more functional, but to help identify other areas of what might be causing the headache or migraine at that time. So once you get the patient a little bit better, they become more attentive to what might lead to a trigger, and they keep a migraine diary, what time during the days they come on, what foods, what triggers it, what activity might lead to a more severe headache, or whether it be related to a new job or a move in their family or other family issues.
yeah, so I mean, it sounds like there's no excuse to not come in and see you.
Well, and that's a good point there, Richard, because what I'm offering right now is a free initial consultation. So I'll evaluate the patient. I don't have to go through a copay or your insurance. There's no money involved. I won't be prescribing anything. I won't be doing any injections, but I will give you a free and honest evaluation of what I feel your headaches might be, what they might not be, and whether or not we can do anything for it.
Okay. Well, that's important, because if you want to do that, if you want to have that free consultation, do I just go to your website, livewithrelief.com, and call your phone number? Or
Yes, absolutely. And we've even made it easier for the patients to come in for that consultation, because I'm opening up a Saturday clinic initially at the Woodlands, so people don't have to take time off during the day or their jobs, time off with their kids. They can come in on a Saturday when they have more time. I can spend a little time with them, and if it works out that there's something I can do, we can schedule an appointment during the week.
Okay. Well, I'm sitting here with Dr. Aves. If you're just now tuning in, he is, what would you say, your pain manager? Or, I mean, you're a doctor, of course.
No, I'm a physician with a background in anesthesia, and I've been in practice now for 23 years, treating all types of pain, acute pain, chronic pain, inpatient and outpatient pain. And I can tell you, I'm not an expert on all therapies, but I would consider myself aware of all the pitfalls.
Mm-hmm.
And by being aware of all the pitfalls, it's really allowed me to be very empathetic to the patient, because not only do I know what they're going through, I've gone through it myself, and I can tell you the frustrations are shared in the room.
That's good. So you're looking for a solution for your migraines. Contact Dr. Aves at livewithrelief.com. Or is this your phone number, 713-863-7246? Is that okay? I can use that phone number?
Absolutely.
So livewithrelief.com. Dr. Aves, thank you so much for coming in and being my guest on Mornings with Lone Star. I know if I have a migraine, I really don't want to now I know I'm probably going to have one now that we're talking about it. But no, I'm just kidding. But no, it's a serious issue, and I encourage all listeners, if it's something that it's been bothering you, contact Dr. Aves at livewithrelief.com or 713-863-7246. And thank you so much for coming in. And if there's anything else you want to tell the audience real quick, go ahead. It's yours. The mic's yours.
All I can say is just let's try to get you better days, more good days than bad, and hopefully I'll see you soon. Thank you very much, Richard.
We're going to be back with more music right now on Lone Star Net Radio, but we're going to take a little commercial break. After the commercial break, we got a little Max Stalling, Jackson Taylor, Mark David Manders, and I think Blake Anderson's going to come into the studio later this morning. So keep an ear out for that here on Lone Star in the mornings.
Hey everyone, this is Tina, your host from Retro Saturdays. I wanted to invite you to visit the Lone Star Studios here in downtown Conroe, Texas. We're all volunteers here, and we need your help in serving the Montgomery County area. Radio media is a fun field to be in. Lone Star Internet Radio serves Montgomery County with news, current events, local programming, and of course, music. If you are interested in volunteering and sharing your talents in media, go to irlonestar.com and let us hear from you. Lone Star Internet Radio, serving Montgomery County from the heart of downtown Conroe.